Hi, everyone. My name is John Mahalchak, and I'm here to share my perspective on living with chronic disease and intestinal failure. Just before I start, I wanted to say a big thank you to IFFGD for this invitation, not only to share my story with you guys here today, but also for many other opportunities they've given me over the past year or so. So today I'm going to kind of briefly just in one slide here, just discuss intestinal failure. And then the bulk of the time, I'm going to share with you my journey, some tips and tricks I've learned along the way, and then at the very end, I just have a challenge I'd like to pose for everybody. So intestinal failure occurs when your body is not able to properly absorb nutrition and fluids when you take them in orally. And because of that, patients then have to rely on intravenous nutrition, which is called TPN, or tube feeds, which is called enteral nutrition. That along with the TPN, sometimes you also require additional IV fluids as well. This can happen for many different reasons. Common ones, short bowel syndrome, inflammatory bowel disease, among others. And this is kind of where my story becomes a little bit different. A lot of these disorders are things you're born with, but for me, as you'll see in a second, that wasn't the case. So as I would say, most GI stories are complex, and mine is no different. It seems to me, talking with other folks in the community, that these very rarely come in singles. Once you get one GI disorder, it's not uncommon to end up with multiple. So my story starts in the freshman year of college. I was getting ready for finals, and I had an episode of severe abdominal pain with some nausea and vomiting. Not quite sure what was going on, went to get checked out, and it turned out that my gallbladder had to be removed. Um, After that, I ended up getting recurrent episodes of acute pancreatitis. So my pancreas enzymes would go very high. I'd end up in the hospital without withholding food to make the pancreatitis go away, and then getting treated with medications and fluids. This was happening for a while, and as I said, when I would be in the hospital, I would end up on enteral nutrition or tube feeds to kind of give my pancreas a bit of a rest. This progressed, and I ended up having a total pancreatectomy with auto islet transplant. So with this surgery, what they do is they go in, they take out your pancreas, they take the islet cells from your pancreas, and they put them into your liver. So your liver then does double duty. It works as a liver, but it also has those islet cells in it to prevent you from becoming a brittle diabetic. When they do this, they also do a Roux-en-Y gastric bypass procedure where they adjust the exiting of your stomach, and then they take out portions of your small bowel as well. When that happened is when I was first really diagnosed with malnutrition. And as a result of the surgical anatomy changes and some other things going on at the time, I wasn't absorbing anything. So I ended up being placed on total parenteral nutrition, or TPN. So I have a port that's in my chest, and I was getting all of my nutrition as well as IV fluids via that port. I also, as a result of the surgery, ended up with gastroparesis. So my stomach wasn't emptying properly. And even when it did empty, things were not moving through, sometimes at all, but definitely not at a normal rate. Because of that, I had a feeding tube placed as well that would allow me to empty my stomach so that I wouldn't vomit, and then to eventually try to switch over to enteral nutrition so that I could get off some of the TPN. So as I mentioned, that's what happened right after the gastroparesis. And then this led kind of to multiple gastric revision surgeries, my most recent just being back in March. So now I have, they've taken out like the bottom third of my stomach, as well as a good portion of my small intestine. And I have, aside from the port that I mentioned earlier that I use for fluid and medication, I also have two feeding tubes now. So I have one that's just in my stomach, and that helps keep my stomach empty due to some of those gastroparesis syndrome symptoms. And then I have the J tube, which goes into my intestine, which, due to the malnutrition and the issues with my the intestinal failure, I can get enteral nutrition when I'm able to absorb, And thankfully, for the past few years, I've been able to stay off of the TP and the IV nutrition to keep my gut working. But it's always a possibility that we may have to go back or forth. My nutrition markers are monitored very closely so that we can make sure I'm getting the adequate nutrition that I need. So with that, so the IV fluids run all night, and then the tube feeds run all day. So I'm always hooked up to my backpack, just making sure that I'm getting all the nutrition and everything I need. So that's kind of my journey. So through this journey, I have learned quite a bit, and those are some things I'd like to share with you now. And probably the biggest thing I've picked up on is that treating chronic illnesses requires a team approach. It's not something you can do by yourself, and every team requires a leader. So after establishing my team and switching to something at my hospital called the Enhanced Care Program, my hospitalizations dropped to less than 2 per year. Um, this is something that happened recently. I've only been in this program for about 2 years, but it's been absolutely remarkable. As you'll see in a second here when I show you who's all on my team, it's a multidisciplinary care setup, which means I have different healthcare providers from across the spectrum who are all working together to help um, keep me healthy. And I was lucky enough to live in a city here in Pittsburgh that has a large academic medical center. So thankfully, I did not have to travel across the country to put my team together, which I understand is something that happens quite a bit in this area. Having said that, I did make one trip to get a second opinion from a physician in Nebraska who I met at a conference. But I do have to say I've been very lucky that I've been able to stay at home during all of the care that I've needed. So, like I said, my team's multidisciplinary. It has a lot of people on it. So I have a primary care physician, as I mentioned earlier, that we call that the enhanced care physician, and she's my leader. She's responsible for my day-to-day care and kind of keeping everybody else on the same page. I also have a GI nutritionist who makes sure my nutrition markers are okay, handles any problems that would occur with my central line or my feeding tubes. I have a dietitian, again, who helps me with the tube feeds and different additives and things that I would need for my nutrition. A pharmacist to keep all my medications straight. A home infusion company to help make sure I have all the supplies I need at home to keep me out of the hospital. I also have a mental health therapist, and I think this is understated. I just want to spend a second on this. I have become a firm believer throughout my experience here that you cannot have good physical health without good mental health. Did not realize this at the time, but looking back, as I was getting sick, I also was experiencing some severe cases of depression. So working with a mental health therapist has really made a huge difference in my care, and I like to share this with everybody because I do know that there is stigmas attached to mental health. And as my therapist tells me all the time, if you're somebody who's going through a severe chronic illness and you're not a little bit depressed, she would be a little bit more worried about you. So I do just like to share that with everybody as well. I also have a surgeon on my team. As I said, I've had multiple gastric revision surgeries, so he's able to help with that, and he's able to help with my feeding tubes as needed. I have an endocrinologist. This is due to that total pancreatectomy I had, so they help keep my sugars in balance for me. I also have a pain management physician on board, and then a physical therapist. So there is one person I left off of my team, and I did that on purpose. And it's mine. It's me. So I am also a critical member of my team, and you are a critical member of your team as well. As patients, we have a lived experience that cannot be taught in textbooks. However, to be an effective team member, being prepared for your appointment is very important. So I'll show you here in a second, but I use a worksheet to document all my visits, and then I keep all these pertinent records in a binder. Here is the worksheet. It didn't copy over to the screen real well, so I'll kind of glance over it, but I will make this available through IFFGD or through a link at the end, however we decide to go down that route. But it basically just lets me document everything that happened at the visit, so any issues that were addressed, changes in plans of care, new medications, and then anything I need to complete follow-up. So going over kind of my story now, I do want to just end. I have a couple seconds left here with just a challenge for everybody. So I hope that today I've been able to show you that there's power to share in sharing your story. And with that, I would challenge everyone here listening today to share your story with one other patient or a healthcare provider. Doesn't have to be somebody you go to see that you have a physician relationship with. And then, as a follow-up to that, at your next GI visit, just tell your GI provider why you love IFFGD and the resources they make available. So thank you so much for allowing me to share my story with you. If you have any questions, please feel free to reach out via email, and I look forward to chatting with everybody during the Q&A. Thank you.